Be covering chapter 21 out of our microbiology for health sciences textbook. And this chapter covers the infectious diseases that manifest in our cardiovascular and lymphatic systems. Let's begin. To begin, we're going to go over the cardiovascular system. Now, the cardiovascular system acts as the pipeline for the not just the human body, but most organisms and mammals, vertebrates, and so forth. Um, it's composed of many components, so this would be the blood vessels and the heart and other such things. The blood vessels, they help move the blood throughout all the regions of the body, and the heart pump through the ability of the heart, which pumps the blood through the body. Um, these also provide uh, the tissues of the body with oxygen and nutrients, and it carries away the carbon dioxide and the waste products, delivering them to the organs needed for the removal of these waste products. Um, this system is also closely related to the lymphatic system, which we will cover just a little bit in this chapter as well. And the lymphatic system is a system of vessels and organs that serve as sites for the development of immune and cells and immune reactions. And it includes the spleen, the thymus, the lymph nodes, and GALT. Here to the right, we got a picture of part of the cardiovascular system, which is the heart, and it's labeled. As you can see here, we got the aorta and all the other organs. If you want to pause now, you can look and review the different parts of the heart. Next, we have the cardiovascular and lymphatic system defenses and the biota. Um, the cardiovascular and lymphatic systems are highly protected from microorganism and microbial infection. And the microbes that successfully invade these two systems, they gain access to almost every part of our bodies, and that means any system can be affected by what is affected in the cardiovascular and lymphatic systems. And for this reason, the bloodstream infections are called systemic infections. And systemic infections are infections that spread by the blood to multiple sites of the body, just as we discussed earlier. And these infections are quite a distance away from the site of the initial infection. Um, there's also multiple defenses against infections, and they reside inside the bloodstream. And one of those is lymphocytes. And there's approximately 5,000 to 10,000 white blood cells, which are a type of lymphocyte for per microliters of blood. And these help protect our cardiovascular systems and lymphatic systems against different types of infection. Down here is a little graph of the defenses and the normal biota of both systems. You can pause now and take a look at these if you'd like. Next, we're going to get into some of the different diseases that affect our cardiovascular and lymphatic diseases. And the first one we're going to cover, I think we're all familiar with from the experiences from 4 years ago, and that is the coronavirus or COVID-19. Now, this was a pandemic that started in December 2019, as we all can remember, and then affected the entire world and caused a lot of issues. This pandemic was caused by a type of coronavirus called SARS-CoV-2, and this can the COVID virus can also set off a cytokine storm, and this leads to what experts call hyperinflammation, which occurs both in the lungs and other organs, as well as our digestive tracts. This virus is also considered nootropic, and which means it infects the cells of the nervous system. And one of the common symptoms of COVID, which we all remember for those who had it, is a loss of taste and smell. And that is why it's considered nootropic. It's transmitted via through respiratory droplets and also airborne. Thus, it can infect people by direct and indirect contact with others, or just by being out in an environment where somebody has been who has had the coronavirus. And as we remember, vaccines were the key to try to prevent this virus. As more studies were done, more vaccines were rolled out, and boosters that helped try to prevent and protect people from gaining this virus. To the right here, we got a disease table that includes all the different factors between COVID. You can pause and look at this, as we're not going to cover it for a short time frame we have here. Um, Next, we have infective endocarditis. And before we get into the infective part, endocarditis is an inflation of the endocardium, which is the inner lining of the heart. The infective endocarditis, or infectious endocarditis, refers to the inflammation and infection of the valves of the heart, such as the mitral or the aortic valves. It includes many symptoms, and this can include fever, anemia, abnormal heartbeat, and sometimes these symptoms can be similar to a myocardial infarction, which is also known as a heart attack. And it can be shortness of breath, chills, it may develop, as well as an abnormal pain in your side, which is sometimes reported to be a symptom too. Um, the most common transmission of this infection is parental. So this would be such like really hereditary. So it would be direct entrance into the body. So I could say parents have it or so forth, or you can get it from different types of drugs. Drug users um, often get this, and they're at a significant higher risk of getting this what other people than what normal everyday people are as well. Um, the most one of the most common treatment for this disease is surgery, and to prevent the spread of the infection, the antibiotics are prescribed before the surgery to prevent subacute endocarditis, which is another form of endocarditis as well. And it prevents further inflammation of the endocardium. Here on the right is a picture of endocarditis and what it may look like on cameras and so forth. And if you wanted to pause here and take a few minutes to study and look at that, you are more than welcome to. The next part we are going to cover is sepsis. Now, sepsis is caused by many different bacterias, well, different types of bacterias and microorganisms. It's not just caused by one. The patients who require sepsis will get a number of symptoms, which would be they're changing their mental state, shaking, chills, gastrointestinal symptoms as well. Their breathing rates is changed, and just a low blood pressure, and then just another hallmark of other symptoms. And this can also cause endotoxic shock, which is a massive drop in blood pressure, which is caused by a release of endotoxins from the gram negative bacteria multiplying inside the bloodstream. Um, and sepsis can also be parental, and it can arise from different infections as well, such as a UTI or renal infections, prostate infections, pancreatic, gallbladder, skin, so forth. And it can also be can happen as a result of not clean surgical tools in a surgery and so forth. Um, the one of a common type of treatment is entrimpic therapy, and it's begun right after the blood cultures are taken. And it also begins with a broad spectrum antibiotic that tries to die down the inflammation and try to kills the infection. To the right here is another disease table with the different aspects of sepsis if you wanted to look at that now. The next thing we're going to cover is the plague. Now, we've heard this medieval times stories, stories based in the 18th and 19th century and so forth, about how all these different famines happen, people getting sick, dying, and one of the results of that would be the plague. Um, and the plague is the different types of plagues are caused by different bacteriums, and they can cause three different infections. The first one is the pneumonic plague, and it's a respiratory disease, and it's acute and it's often fatal, and it's a form of pneumonia as well, and it's called, I'm sorry if I mispronounce this, Yersinia pestis. The next type it can cause is the bubonic plague, and this is often caused by a flea bite, and it's a form of the plague in which bacterial growth is primarily restricted to the lymphs, and it's characterized by the appearance of swollen lymph nodes, which is referred to as bubo. It also causes the septemic plague, which is a form of infection, which is a type of pneumonic plague, which occurs mainly in the bloodstream, and its mortality rates are extremely high as well. There is no vaccine for the plague. It is currently not offered in the United States and no other part of the world, to my knowledge. But it is being worked on, and once it's found, it'll be a medical marvel. To the right here is a picture of the bubonic plague. As you can see, right here is the inflammation, and this can also often be fatal as well. Um, Next, we got Lyme disease. Now, this is a common term you hear in our area we live in because we have a lot of ticks. And this disease is slow acting, but is but it evolves into a progressive syndrome that mimics neurological diseases and rheumatoid conditions and so forth. This is caused by a tick bite. One big symptom of this disease is a rash by the site of where the tick is bit, and it's often a lesion, and it looks like a bullseye with a raised ring, and it's in a reddish color in the area of the bite. There's currently no vaccine in that is offered that can prevent this disease either. But there are studies trying to get one out. The one way to prevent Lyme disease is for people who are out to do outdoor activities often is to wear protective clothing such long sleeve shirts, boots, leggings, insect repellent, and so forth. And it helps prevent ticks from getting on the skin, thus prevents less bites. Here is to the right is a cycle of Lyme disease. So starts with the tick bites the other animals and so forth. If you wanted to pause and read it now, you can. But as said earlier, due to the limited time frame, we're just going to move on and keep trucking through this lecture. Um, and then lastly, we got infectious mononucleolus. Um, this is also mainly known as mono, uh, and it's caused by the Epstein-Barr virus or ESB, which is a herpes virus that's linked to infectious mononucleolus, uh, Burkitt's lymphoma, and a couple other different infectious diseases as well. Symptoms include sore throats, high fever, cervical. Sorry if I mispronounced this, but lymphadenopathy, and which will develop after a long incubation period, which can take 30 to 50 days as well. And this can be transmitted through direct oral contact with others. Contamination with saliva are the main modes of transmission. It can also be transferred through blood transfusions, sexual contact, organ transplants, and so forth. But it is rare to see a big outbreak of mono in communities and throughout the world and so forth. The treatment for this mono is usually treated as a symptomatic relief for a fever or sore throat, and it's rare that you see hospitalizations of people with mono. Occasionally, you'll get the rupture of the spleen, which necessitates to immediate surgery. Thus, it causes to removal of the spleen. And to the right here, there is another uh, disease table from our textbook, which gives the causative agents, the most common modes of transmission, prevention, treatment, and so forth. And that concludes our lecture for this week.